Everybody in from out? Excellent. Hi, everybody. My name's Romany. I'm the immunisation nurse with Tropical Public Health Services Cairns. I'd like to acknowledge the traditional owners of the land in which we meet tonight, past, present and future. A bit of a different take tonight with Dr. Alistair Kaiser, our Reg, doing a presentation on myth busting. And then we're going to do a little bit of influenza program information and open it up to you guys with question and answer time with all of us from the Public Health Unit. So,
thank you.
Take it away.
Do you want to use that, or can everybody hear me okay, or should I use the mic? Use the mic. Is that better?
Mic, please.
Okay. Look, my name is Alistair Kaiser, and I'm the registrar at the Public Health Unit. First of all, I think it's really great that so many people came out tonight. I didn't actually realise that flu was such a sexy topic, but it's good to see everybody here. When Ron was talking to me about presenting myths, I started thinking about myth busting, and then I thought, well, how can we actually jazz this up a little bit and actually provide some relevant information? So, look, if I could ask you all a favour, I could present this to you, but it would be really great if people have questions, stop me, or if you want to ask something or say something, feel free to do that as well. I absolutely don't mind. And the same goes for the team, Richard, as well. Thanks. Okay, so just very quickly, some key messages. Look, flu kills. 21st century, and we're still plagued by the flu, no pun intended. It's very important as healthcare professionals, we need to convince ourselves about the flu, and part of the issue we have is that a heap of health professionals are still not convinced that the flu is an issue that we deal with every season. So we need to convince ourselves. The other thing is we deal with patients, with people every day, and we need to actually understand their motivation for being vaccinated or not being vaccinated. At the end of the day, the conversation starts with you and it starts with me. I'm going to say it again, the conversation starts with you, not with the patient, but with you. And we need to tackle those difficult questions head on, and we'll get on to that a little bit later. So we're not going to duck and dive those tough questions. Look, at the end of the day, you're not going to convince everybody. It's not our job to convince everybody. It's our job to provide them with information that's understandable, and so they can actually make some good decisions for themselves and their families and for the community at large. All right, so this is where we are, 2018, and, we need to convince ourselves. I've already said that, so you decide. So let's look at, this is, by the way, some national figures from the 2017 flu season here in Australia. So let's just quickly go through this. I don't want to bore anybody with numbers, but I think it's quite telling. In Australia, we have about 56,000 GP consultations every single day. So 15 consultations per 1,000 for influenza-like illnesses equates to almost 1,000 consultations every day in the country just for flu alone. Okay, that's quite a lot. Nearly 250,000 cases, confirmed cases, reported last year. And that's probably conservative because we know that there'll be many more that were probably not confirmed or reported for whatever reason. 29,000 admissions across the country for flu. And for those that were children, we know that a third of all admissions occur under the age of 2 years. So we know that that's an important age category, and especially for those kids under 6 months. 10% get admitted to ICU. That's 2,900 cases, confirmed cases of flu, admitted to the ICU at $10,000 a day. That's $29 million just for one day. That's a big hit on the health budget. Okay. Last year, unfortunately, we had 1,100 confirmed deaths directly as a consequence of influenza. About 10% of those were active individuals in the population. The other 90% were people aged over 65 years of age. What that really means is you've got about 110 to 115 younger people that were part and active in the community that are no longer with us. And then lastly, for every one non-Indigenous notification, we get 2.5 Indigenous notifications. So I'm going to ask you again, you decide, you tell me or you tell yourself whether you think flu in this day and age is still relevant, whether we are actually, good at what we do in terms of starting that conversation. And actually, before I forget, I meant to ask, I'm not going to ask anybody to show by way of raising your hands, but it'd be interesting for me to see how many people in this room, being healthcare professionals, have actually got their flu shot. Oh, 3 of you, that's awesome. No, just kidding. Let me ask you this then. In the last week, how many of you have actually started a conversation with patients you've seen, whether it be on the wards or in your practice or wherever? As part of primary care, primary healthcare, it's what we should be doing. Okay. Right. I really love this slide. Can anybody tell me, what do they think in relation to flu? What do you think the elephant in the room is? If you think about flu and the myths around flu, what are the common things that we struggle with? Sorry, I didn't hear that. Can you say? Yeah, that's a good myth, but that's number 2.
Can you say it? Because they can't hear us.
Oh, right. Okay, so it says, let's talk about the elephant in the room. Oh, sorry, the answer to that was you can catch flu from the flu shot. What I really was thinking about, though, was vaccine effectiveness. A lot of people say, oh, well, the flu shot's not good, so why do we bother doing it? I like to think about vaccine effectiveness as not being effective, but as more like being... Right, all right, moving on. Okay, look, this is a graph from the CDC. This is a snapshot from 2004 to 2018. So what the CDC, Center for Disease Control in the US, does every year, they do several studies in relation to vaccine effectiveness, and this covers all of the age categories as well as the strains of, or should I say, vaccine components in relation to the vaccine effectiveness. And you can see that it's very variable. In 2004, particularly horrible season, 10, right, 10%, 60% in 2011, that's pretty good. In Australia, we vary between 35% to around 65%, which is slightly better, but it's still reasonably variable. We need to be honest about that, right? We need to be honest about that. So why is it like that? I mean, so why is vaccine effectiveness so variable? Well, it's determined by quite a few things, but the 2 broad categories when it comes to vaccine effectiveness is personal characteristics. So we know age is a factor, ethnicity, and obviously people's overall health and well-being. People with chronic disease, for example, are going to be more susceptible, etc. We can't do much about that. Well, we try and do something about chronic conditions, I guess, but at the end of the day, there's not much we can do about people's age or ethnicity. What we can do, though, is we can try and match the vaccine component to the circulating strains of influenza virus. But as you all know, that can actually be very tricky and a very difficult thing to try and achieve every year. And sometimes we get it right and sometimes we don't. Part of that issue is that sometimes when the vaccine strains have been, or when the strain of virus has been identified for the following season and they begin to produce the vaccine, what happens is that strain changes, but the flu vaccine has already been produced, and so we don't actually get a good matching vaccine component with the influenza. So I guess the question then is, if the effectiveness is so variable, why do we actually bother to vaccinate at all? Well, one of the team basically said to me the other day, because it's all we've got. And I think that's pretty apt. It is all we have, and we do the best we can with it. But let's just put that into context. So, amongst adults, you give them the flu vaccine, you actually are going to reduce flu by 60% in people over the age of 50. You're going to reduce hospitalizations in people with chronic conditions, particularly those with diabetes, with chronic lung disease and cardiovascular disease significantly. And my personal favorite, the pregnant woman, you're going to reduce the risk of them developing flu by just over 50%. What's really telling about that is it also, and I haven't put it up there, it also reduces the complications from flu. And probably very importantly, and what's often forgotten in this particular statement, is that it protects the unborn child through placental transfer of the antibodies for the first 6 months of that child's life, which is really, really important. We'll talk a bit more about that. And in kids, we know that it reduces the overall risk of death from influenza directly by 65%. So that's 2/3 If you said to a mom or a dad, we could reduce the risk of your child dying from influenza by 2/3, I think that's a reasonable thing to tell them. And you know, if you're a gambling person, you can work it out for yourself. The other thing is reduces the risk of death from influenza in children who have high-risk medical conditions by 50% as well. And then the one that really astounded me was the reduction in pediatric ICU admissions by 3/4, and I think that's quite significant. Look, you know, at the end of the day, I just think that if we have increased vaccine coverage, we're going to reduce the risk of spread in the community. And regardless of how variable the vaccine effectiveness is, it is all we have. And without it, our flu stats would be a lot worse. And I think last season, because we had a reasonable mismatch, it was actually quite a horrendous season. And we all know the outcomes of that.
So it says that the overall risk of death is decreased by 65%, but children with high-risk medical conditions decreased by 61%. So the ones with low-risk medical conditions decreased even further.
Yes, that's correct. Sorry, was that the question?
Because it seems...
Yeah, so that means that the children with low-risk medical conditions, it's either 70-something or 80% effective to average out to a 65% overall mortality benefit, right? Or am I reading that wrong?
No, so what's actually going on there is that the first one is taken over, is all admissions. So it's not, they haven't actually singled out high-risk children, or it's across the board, and then the one with the high-risk medical conditions is only children with high-risk medical conditions. Oh, sorry, are there any other questions? I'm going quite quickly, but if you'd like me to slow down or stop or focus on something, please let me know. All right, my personal favourite, right. I think we've all heard about anti-vaxxers. They're a very vocal minority, and that's the point. They're a minority, 2% in Australia. Now, there's actually been some really good studies done in the last 2 years about individuals and their vaccine preferences here in Australia. I've actually listed 3 main groups. There's actually 5. But just for ease of understanding, I've narrowed it down to 3. Anti-vaxxers, 2%. Interestingly, most of them are female, reasonably highly educated, tertiary education, married, high income, and they're also pretty hardcore. So if you're going to try and convince an anti-vaxxer to change their mind, I would suggest you rather hit your head against a wall. You probably get further where that won't be as painful. The idea of speaking to anti-vaxxers isn't that we don't speak to them, it's just that we don't get into any arguments with them because they're set in their ways. Vaccine adherent individuals, approximately 80%. They're the majority of our population. We don't have to actually, convince any of these people. They're quite compliant. They understand the issues and they're happy to be vaccinated. What we need to think about, though, are the group who potentially are vaccine hesitants, and they make up about 20% of the population. What's interesting about that middle group is that when it comes to the national immunisation schedule, they're quite happy for vaccines to occur in their kids or even themselves. But for issues around flu vaccinations or other vaccines, they often have questions around vaccine effectiveness and vaccine safety. And these are the people that you need to be ready to converse with, especially with flu, because a lot of people think that flu is an aside that they don't actually need. Now, I promise I'm not going to go into psychology at all. Actually, while I'm on this, Rom, can you just pass some of these around? Look, moral foundation theory, very interesting theory. A heap of studies have been done that actually found that all of us basically work off a framework of 6 core values, and these 6 core values determine how we make our decisions every single day. Now, I'm not going to read them out. You can see them there. The questionnaire that's been handed out is the Moral Foundation's self-scoring questionnaire, which will help you determine where you fit on this particular scale. Now, when I did this with our nurses, I found that they scored very highly on care and fairness. Well, I would expect that from nurses. Care and fairness is something I think that health staff generally would score highly on. Interestingly, when it came to anti-vaxxers, purity and liberty is what they scored the highest on. And people who are vaccine hesitants also tend to score more highly on the purity and liberty. Now, purity equates to safety, and the liberty, obviously, to freedom. And if you look at all the anti-vax forums, you'll see that they're full of safety issues with vaccines. And they also talk about freedom to choose and how the government takes away your right to choose. What's interesting, though, is that as health professionals, what we do is we tend to talk about how safe vaccines are, and all it serves to do is to actually reinforce to anti-vaxxers how unsafe the vaccines are. Now, the only reason why I mention that is because that's how Donald Trump came to power, apparently. The more people said how bad it was going to be, the more people disbelieved it, and so he was voted in. So we have Trumpism. The point there is that if we keep hammering on about how safe vaccines are, you're not going to change people's minds. What you're going to do is you're going to cement in their own minds how unsafe they actually are. What you need to do is you need to change the conversation. So rather than talk about how safe or try and rebut the arguments of how unsafe vaccines are, you need to talk about how unsafe or how unsavory the disease is. By focusing on the disease and not on the vaccine, you begin to change the mindset of individuals who may not want to actually get vaccinated. I've mentioned this already, starting the conversation.
Sorry, Alistair, it's Ron. For those of you that got one of those pieces of paper, we're hoping that you might take 5 minutes to quickly fill it out and randomly give us an idea of where the audience is sitting tonight.
Yeah, great, thanks. When I had a look at these figures, I was quite surprised to see that 83% of information for vaccinations, vaccines, etc., came from GPs, and 10% from nurses. What that tells me really is that the majority of our population gets information from primary care and primary health care services, and that basically is everybody in this room. So starting the conversation is absolutely vital. I just want to say very briefly, the way in which you frame your question is really important as well. Following on from the purity and liberty and moral foundations theory, what you have to avoid is omissions bias. So if I say to you, I think you need to have a vaccine, or are you thinking about having a vaccine? Or my body language portrays, if you ask me and I go, yeah, you should probably have a vaccine, I'm not filling you with a lot of confidence. What I need to be saying is I need to reframe that. I need to say, have you had a vaccine? Have you had a flu shot? Has your child had a flu shot? And if I'm asked the question, I need to be firm and go, you have to have it. It's really good for you because my body language is telling you it's the right thing to do. That way, there's no omission in your statement of intent. People read you loud and clear, and so there's no doubt in people's minds. So you need to think about that when you're talking to your patients. Once again, Connors and Hodges last year here in Australia came with some really good research. And this is not new to anybody in the room. We know this. But I've just put it up there just to remind us all again. Building trust and a good relationship with the people we see and the patients is absolutely vital. Talking to people and also listening to them and validating their concerns is part of what we need to do. We have to actually understand the person's moral palette and where they're coming from. If we don't, we're not going to be able to engage in a meaningful conversation. I've already mentioned excessive persuasion around safety. We need to avoid those discussions, persistently around safety. And obviously, we never get into any adversarial debates with people. We never get cranky. We never get grumpy. You provide information and that's it. Point number 6, information resources. I was surprised by that. But apparently what people do, and I guess it's common sense really, people take the information home and they read it in their own leisure and pace and they process the information, and often at a next consultation or with another healthcare provider they may continue the conversation. So we may start the conversation but it may well end with somebody else. We may not see that end result, but at least we've actually been part of that process. And this is what we need to do when it comes to flu. We need to keep reminding people about that. All right, so finally we get to, so let me just recap very quickly. We've touched on a lot of areas. The point about the previous slides was just this. We need to convince ourselves, we need to think about vaccine effectiveness and we need to be honest about it and we need to be ready with an answer for people who actually tell us one thing which we know is not fact. And then we need to start the conversation. As healthcare providers, it's up to us. So let's just look at a few of my favorites. This goes back to vaccine ineffectiveness. The flu shot doesn't work. We hear that all the time. I'm not going to spend a lot of time on this. We know that it actually works. I've already been over it. We know that it reduces presentations to the emergency department as well as GPs. We know it reduces the risk of dying, hospitalizations, people with chronic disease, Indigenous folk, and so on. We know that it's actually really good at preventing an all-out flu epidemic, especially when the circulating strain is well matched to the vaccine. So let's not spend much more time on that. But that's probably the number one. But the second one is, as the person at the back of the room said, I got the flu shot last year and it was the worst flu I've ever had. People think that you have the flu shot, it actually gives you flu. That's not true. Right? None of the flu vaccines that we use in Australia are live viruses. They're all inactivated viruses. In North America, they use recombinant flu vaccines in some places, and there's nothing live about that either. So, it can't give you the flu. The most common complaints people have is a sore arm, a redness. Sometimes, uncommonly, people will complain of a low-grade fever and feeling of general unwellness, and then I just say to them, congratulations, you've just had an immune reaction, you'll be fine, good on you. You're not going to get the flu. Here's another good one. I'm not going to have the flu shot because I want to keep my baby safe. We have a lot of people who still believe that if you're pregnant, you shouldn't have the flu shot. And these are the people you need to engage with when you start the conversation, because obviously pregnant moms are one of those high-risk categories. So just to put everybody's mind at ease, we've never ever had an adverse outcome in any child born of a mother who's had a flu shot. There was one case of an adverse reaction recorded in a mother who was pregnant in North America a couple of years ago or several years ago. I understand that it wasn't actually an anaphylactic reaction and there was no long-term sequelae from that or any issues with the pregnancy, the delivery, or the child, and the mother was completely fine. The other thing that's really important in this section is to remember that through passive immunity, the child is protected for the first 6 months. So we don't vaccinate in the first 6 months. The child is protected, and that's really, really important, okay? The flu shot in a pregnant woman at any time or any stage in a pregnancy does prevent the risk, not only of flu, but the complications that result. It's really important to get that message across. All right, the other one is I'm young and healthy. I don't need the flu shot. I'm strong like bull and all that other stuff you've heard. I don't need to get it. So by and large, we know that generally the flu doesn't impact heavily on young adults. However, we do know that there are times, like in 2009, when the H1N1 strain that came through did disproportionately affect younger people. We also know, though, that in terms of vaccine effectiveness, if there's a good circulating strain matched vaccine, you can prevent more than 3/4 of cases in young adults as well. So there's a good argument to be had for everybody to get it, not to mention, of course, that when you are vaccinated, you reduce the risk of spreading it to the rest of the community, your family, and so on. So there's never a reason why people, doesn't matter the age, there's never a reason why people should not actually be vaccinated. The other one I'm sure you've all heard is I had a vaccine, I had my vaccine last year, I've had a flu shot, I don't need to have another one this year. We all know that that's not true. We know that there's two things that occur. There's antigenic drift, and we know that the virus undergoes changes every year. We know that we've got to match that every year, and we've spoken about that through, when we discussed vaccine effectiveness. We also know that our immunity diminishes with time. So we know that having a regular flu shot is absolutely vital. So having a flu shot every year is not actually something we need to discuss. It's just how it is, and people need to understand that. Here's another one that I find really interesting, because unfortunately, when I discuss this with healthcare professionals or healthcare providers, I find this a lot amongst healthcare providers. They basically say, I work with a lot of sick people, I have a really good immune system, and because I'm exposed constantly to ill people, I don't need to get the flu shot. So I think that's completely wrong on many levels. I think if you're actually treating people who are at risk, particularly young children, if you're working in an aged care facility or residential care facility, or if you're working in a hospital or any care, I think you have a duty of care to those patients, as well as to your family and the community around you, to lead by example. But generally, just because you haven't had the flu in the past doesn't mean you're not going to get it in future. And the other thing, once again, is that you can actually spread the flu. And the more people that we vaccinate, the less likely there is of risk of spread throughout the community. So, once again, it's one of those cases people need to get the flu shot, regardless of how well they are or how well they think they are or how old they are. Everybody needs to get the flu shot. All right, other things that make me miserable, fables and other nonsense statements. Can I just say, the top one is my favourite. It's a bad cold. When you have rigors and arthralgia and myalgia and you feel really ill, that's not a cold. And I don't care how many buckets of vitamin C you take, it's not going to prevent you from getting the flu. That's just a big no-no. In 2008, Australia spent $600 million alone on vitamin C tablets. That was 2008. $600 million on vitamin C, only vitamin C, not vitamin B or anything else, just vitamin C. I wish it was so, but you cannot treat the flu with an antibiotic, okay? Flu is uncommon. Yeah, we could ask the 250,000 people last year about that. I think they'd have something to say about that. Children can't get the flu. They do get the flu. They get it really badly and they die. So let's put that one to bed. And it's actually not too late to get the flu shot. Even late in the season, we can still vaccinate people. We should always be encouraging people to take up the flu shot, especially those that are high risk. Okay, and this year's clanger. Emerging myths, no doubt we'll see a bit more of this. Rom told me the other day that we've had 600, is it 600? 600 media reports this year alone in relation to the flu.
In Queensland.
In Queensland. And I read something about, in Darling Downs in the paper just 2 days ago about this particular aspect of the current or this season's flu. Look, quadrivalent, trivalent. The issue there, and I don't know, Rom, if you're going to go into more detail, but I'm happy to discuss it quite briefly now. In relation to the trivalent, people have thought, well, it's got 3 in it, so obviously it's not as good as 4. I mean, after all, anything with 4 must be better than something with 3, right? That's not true. If you're over 65 years of age, you are much more likely to get a strain of flu A, right, and less likely to get a strain of flu B. So the H1N1, H3N2, particularly the H3N2 is what affects oldies quite a lot, all right? And the trivalent does 2 things. One, it actually focuses on the A's. So we have 2 A strains and 1 B strain. The B strain that's been removed is the Brisbane strain. It's a 2008 strain. So it's aged somewhat. It's also the strain that is least likely to affect people over the age of 65. And they postulate that it's because people over the age of 65 have been exposed to it already and are much more likely to be immune to it compared to people that are younger. So we focus on the 2 A's and the B. Now, the other thing about the trivalent, like the Fluzone, is that it's actually got 4 times the antigen in it, which gives you an incredible boost when it comes to an immunological response. So what we know about people over the age of 65 is that when we immunize them with the flu vaccine, they don't mount as good an immune response as people under the age of 65. So this is a vaccine that's been especially formulated to tackle those issues. And unfortunately, in our community, there's been a lot of mismanagement around the communication of this. And it's really important to understand this and be able to explain it succinctly to those people that come and see you for a vaccine so that they understand why they're getting a trivalent and not a quadrivalent shot. No doubt we will actually hear a bit more about this, but this is this year's emerging myth. Or,
So I had a 65-year-old that says, I want the 4-strain one, and I have a 64-year-old who goes, well, can I have the 3-strain one? And what is the actual difference? If they wanted to, can we give it? That's the first thing. And then second of all, if we can't give it, what is the best response for that?
So you're asking whether we should actually give that individual the tri and the quadrivalent? Is that what you're saying?
So over 65, they get a trivalent one, but I had a gentleman who wanted the quadrivalent one instead because he felt that 4-strain one is better. And then I had the reverse situation where a different person wanted the quadrivalent when they should get the trivalent one.
So this is where I'm going to put this back on you, because these are the conversations that we need to be having with our community members. And part of this is the myth that people think that they've heard that the quadrivalent is better. The way we actually describe this and explain it to our community is really, really important. They're just on that, and this is part of answering your question, is what I've seen as well is that people have gone, I'm over 65 or I'm 65 or whatever the case may be. That trivalent one is funded. It's free for me, so I'm going to get it. Do I need to pay for the quadrivalent one as well and get an additional vaccine? So the evidence suggests that that is not only not necessary, it's actually potentially not good for the person. So I would not be advocating for giving them 2 shots. They need the trivalent strain. To answer your question, though, at the end of the day, what do? Would you rather not vaccinate the person, or do you rather give them the quadrivalent? Richard, I don't know what you think, but I'd be inclined rather to give them the quadrivalent. If they're going to have nothing and walk out because they want the quadrivalent and they're prepared to pay for it, would you rather give them nothing, or would you give them something?
If you just explain to them why they get one over the other, they've been age-dependent and their immunity may already be okay for that 4th one that's been removed. Maybe if we just explain it in simple terms, maybe that's all you really need to do. Maybe that's what people want to hear, because they obviously have no idea why they're getting one over the other. So.
No. And sorry, so that's getting back to your question, that's the point. And, you know, I can describe it to you quite easily because you're all healthcare professionals, and so we've heard of this terminology before, but it's trying to explain it in layman's terms that people can understand so that they can make an informed decision. Bearing in mind, though, that we don't force people to do things that we want them to do. We need to provide them with all of the information, but at the end of the day, you know, they have to make a decision for themselves, and it is actually quite difficult. But I think if we can work from the basis of trying to explain it clearly, so that they understand, then perhaps we'd change their mind about what they think is better for them.
In terms of the under 65-year-old wanting a trivalent, it's actually not licensed for use in that age group. So that's one of the other big pointers for that one.
Robin's got a question.
Cheers. In relation to children, Indigenous children from 6 months to 3 years having it for the first time, it's very easy for parents to say, yeah, I'll have 1 shot, but then not really keen on having 2. Is there a more rational health? And I understand that they carry, as little tots on the ground, they carry a burden of disease, but I haven't yet been able to think of a good way to explain why they need 2 shots.
When you find that out, can you let me know? Can I just say, I think that's a really good question, because we've discussed it in our team as well. We've gone, well, how do you get people to come back? And it's not only around the flu. It can also be where we've perhaps inadvertently given people the vaccination at the wrong time and we expect them to come back again, or we've given them the wrong vaccine. It's having that very difficult conversation and trying to convince people to come back. It's hard to do, and once again, this is one of those difficult conversations that I've said you need to tackle head on, because there's no easy way around it. And I don't have the answer for you, Robin. I don't know.
So now, thanks to Nancy, I've just got the vaccine schedule up on the wall, and I say to parents, this is what we're doing.
And do they go with that? You did see the picture when I was talking about anti-vaxxers. That was a photo taken out of the United States where the caption says, lining up to avoid the vaccine. And there's a picture of women in Africa saying, lining up to get the vaccine. I think sometimes, we need to, and it comes back to the question of your morals foundation and understanding people and respecting that, and then trying to work within that framework. It's not about hammering people, it's about working with people. Okay. Just a final word on elephants, I guess.
Sorry, Alistair, can I just stop? Anyone online want to ask a question? Because we actually can hear you.
Hi, Nancy, it's Alison. For me, with the children less than 9 getting 2, I explained that they're young and naive, and often they haven't had the disease exposure that the older people have had, and that their immune system needs that double dose to basically get their system to recognise and build an immunity, and the second one is to grow that immunity and be more effective. Most parents seem to take that well. And with the over 65s, once you explain it's designed specifically for their age group and that it's got a turbo boost in it for their immune uptake, they're understanding of it. But the biggest issue I've had is probably pharmacy and the dispensing of the wrong one to the wrong age group.
Thanks, Alison.
Thanks, Alison. Anyone else?
Helen?
Should we carry on? Let's carry on. Okay, there's an African proverb. How do you eat an elephant? One mouthful at a time, right? What we have to do as healthcare professionals is we just have to start the conversation and keep chipping away. Difficult conversations, myths, changing people's minds, providing them with information. You know, with some people it doesn't happen overnight. It may take 2 or 3 or 4 consultations. It may not even happen this season. It may happen the following season. But what we have to do is we just have to keep chipping away at it, and we have to keep on keeping on. So that is my message to all of you, is when it comes to flu, when it comes to any vaccination and difficult conversations, just keep on keeping on, okay? Lastly, look, just a few useful sites. The NCRS is great. You probably all know about that already, but you know, if you want any information, get onto their website. It's great. And then for anybody who's after any of the references from the study, I have several pages of these. So if you'd like me to send them to you, please come and see me afterwards. I'll be happy to send them to you. And thanks for listening.
I'm just wondering whether anybody in the room or online has any other interesting myths or anything like that